All right. Well, good afternoon, everyone. And it's so great to be here with all of you. My name is Ben Allen. I'm your state senator. And this is one of a series of town hall fora that we've pulled together to talk about important issues that are impacting people in the district and in our area. I'm very proud to represent the West Side communities of Los Angeles County, the western portion of Hollywood, then of course the South Bay, the coastal South Bay communities as well. So we're here today to discuss an issue that's, I think, rightfully gained considerable attention over the past 2 years, and that's that of student mental health. And the pandemic, of course, has presented many challenges to students, teachers, and parents. Our children have been especially vulnerable as we've grappled with the broad impacts of school closures and reopenings, physical distancing and social isolation, family loss or instability, and other unexpected changes. And even as schools have, thankfully, remained open for in-person instruction over the past year, the mental health toll of this pandemic is still very much impacting our students. That doesn't even get into the impact that was on our students before the schools reopened. So the ACLU of Southern California recently released the results of a study examining the mental health of California students during 2021. The findings were really alarming. They surveyed more than 1,200 students across the state, and the researchers found that over 60% of the students reported having an emotional meltdown in the past year. Pretty high for such a strong statement. 43% had suffered one or more panic attacks. 22% had missed 3 or more days of school due to mental health reasons. And when surveyors asked students to describe their feelings, the top results were stressed, tired, overwhelmed. But while the pandemic has certainly exacerbated the student mental health crisis, we also know that many of these issues predate COVID. I mean, quite frankly, for too long, we failed to adequately invest in our children's emotional well-being, in fact, our emotional well-being as a society. Now, that being said, I think the issue is finally getting the attention, some more attention in Sacramento. I actually was just watching our health committee, and it was an important topic of discussion just today. Last year, we passed a budget that made historic investments to transform behavioral services for young people across our state. We allocated $4.5 billion for the Children and Youth Behavioral Health Initiative, which aims to streamline services and funding among schools, public health departments, and community health organizations, as well as funding staff training and school wellness centers. We also passed legislation creating a student mental health referral protocol and requiring that middle and high school health classes include mental health education in the curriculum. The Department of Education, our state Department of Education, has announced plans to add 10,000 more counselors to our state's public schools by providing scholarships and streamlining the licensing process. There's several bills that are making their way through the legislature right now to ensure that those goals are met. So there's certainly some attention and progress being made at the state level to combat this crisis, but we know that the real work of supporting our students' mental health and their well-being really does happen on the school campuses and of course, most importantly, at family dinner tables. So that's why I wanted not only to update you on what's happening in Sacramento, but also really make sure that you're hearing from mental health experts and school officials on what support is already available. We've got representatives from several school districts with us here to discuss what each of their districts are doing to support our students during these challenging times. We'll be hearing from them in a moment. I will say, of course, I represent a lot of school districts. We only have a few representative samples, but we will be posting existing resources for all the school districts that I represent, and some also for Los Angeles County Office of Education, which covers all of Los Angeles County. And certainly we are very happy to connect any family with the appropriate resources in either in school districts or local mental health folks in the cities or at the county level to make sure that you can get the support that you need. So first, though, I want to introduce a true expert in this space, and he's the first of our panelists. This is Dr. Jonathan Goldfinger, who not only has the last name of one of my favorite James Bond films, but he's far less nefarious than the one in the movie. Dr. Goldfinger will be speaking more on how the pandemic has impacted our students' well-being, along with some basic mental health strategies for students and parents and educators. He's a nationally recognized pediatrician. He's an advocate for mental health services for children and families. He currently serves as CEO of Didi Hirsch, which I'm sure many of you know about. It's a nonprofit organization that provides mental health and substance abuse and suicide prevention services to communities all throughout Los Angeles County. A good person and a very smart person who knows a lot about this topic. I want to thank you, Dr. Goldfinger, for joining us.
Thank you, Senator Allen. And thank you, everyone, for joining us today. Thank you to your team for setting this up. We get lots of questions from parents, educators, policymakers. It's great when we can all come together, even professionals. We can all continue to learn. So I'm going to do my best, and then you have really esteemed panel of colleagues who will take us through. And I'll try to share my screen here real quick so I can kind of set a little bit of the stage of where we are today. And, you know, as the senator said, there's really significant recognition across the United States and the state of California and the county of Los Angeles and even the city of Los Angeles and other local cities of the need to address student mental health. We have tremendous efforts going on in legislatures across the country. And I would say from, you know, studying these things and really trying to support them nationwide, most of all in Sacramento. So we are so grateful, Senator Allen. And, you know, before we dive into all of this, we want to say thank you for your leadership and for that of the legislature and that of Governor Newsom to really pass monumental legislation and investments for kids and for families and for schools and for all those in schools. So I'll try to share the state of the state here in terms of mental health. I want to start out with the message of hope. There really is tremendous investment coming in this, and we're all in this together to make sure it gets where it needs to go to our kids. So not to rehash too much as the senator was sharing, we know the significant impact of the trauma of the last 2 years, the losses, the inequities, the racial and social justice movements that kids are witnessing unfolding in real time, the politics happening day to day, bipartisanship. These are all contributing to mental health effects in our students, in our families, and in our schools. Shouldn't forget the professionals who are serving day in and day out by teaching our students and caring for them in schools. And the way this affects kids, we often call these things adverse childhood experiences. The difference between that, ACEs, and trauma is that the ACEs are what they experienced, the activity that happened or the thing that happened to them. The trauma is the effect on it, whether it's emotional, physical, or both. And in the moment of it, but even lasting, kids can have trouble listening, learning, engaging in the classroom. Anyone with children knows even a little bit of, you know, staying up too late can lead to this. Now imagine the level of stress when they don't feel safe and their systems are on edge. They just want to flee, right, and get to safety, let alone listen. Okay, it's time for circle time, right? Put the toys away, take out your workbooks, hand in your homework. Did you bring in your homework, right? Did you do your assignment? Focus on this test, focus on your applications, college, all the way through. Kids are struggling with this. And we know from the data that we have that about 1 in every 2 children, teens, and even young adults is showing symptoms of depression or anxiety. 25% of kids have experienced worse emotional and cognitive health. And these are significantly worse in our LGBTQ plus identifying and youth of color. They're more significantly at risk at baseline of having mental illness. They also experience it as a stress. The mental challenges kids have faced has become itself a stress because they don't feel the relief, and particularly in these marginalized and underserved youth, they know that they don't have sufficient adults that they feel comfortable talking to. So the antidote essentially to adversity are what we call safe, stable, nurturing relationships with adults. And the kids in schools are not feeling that, especially if they identify with these demographics. And so in kind, we have essentially what was alluded to on top of existing challenges with mental health for many years, the perfect storm, if you will, where now so many have mental health challenges, even at young ages. so many cannot access care, and therefore over 1 in 4 young people in the pandemic was shown to contemplate suicide, taking their own life seriously. And tragically, in the last data we have, over 6,000 lives lost to suicide in 2020. And that data lags. We anticipate a higher number for 2021 when the data is out.
And that was an increase on the year before, Dr. Goldfinger?
Yes. The only populations whose deaths by suicide increased in America in the pandemic so far from the data we have are kids, teens, and young adults. And disproportionately increased in Black and Latinx communities, Native communities, and those identifying as LGBTQ+. And we see this on our clinics at Didi Hirsch. We provide, an 80-year-old organization, provide everything from outpatient treatment, medication management, therapy, support groups, all the way through to crisis residentials and some of the crisis care I'll share. And what we see is the internalizing behaviors, as we call them, or mental illnesses of depression, anxiety, trauma. These are on the rise. Our data is already showing what we saw in 2021 was worsening, while the externalizing behaviors really didn't change as much and were a little lower. And teachers may experience this differently. It's different once they come to our clinic, perhaps just with family or even on their own if they're older, compared to what you see in the classroom. But overall, this is concerning because this is also, these internalizing behaviors and mental illnesses are a setup for suicide. And so this is why, one of the reasons we see it. And you alluded to the statewide survey. There was a recent survey by United Way, LAUSD. There's a lot of information on this slide. We can share it, not to belabor it, but a few of the really interesting findings, how much the kids recognized that mental health was critical to their learning. And the stressors leading to mental illness, leading to challenges with how they were thinking and feeling, were not just about the trauma, but some of how they had to respond, especially in our lower income and our Black and brown communities, where the kids said if they were BIPOC and college bound, right, identified as BIPOC, that they were more likely to feel the stress of getting good grades, that was harder for them. Where they had increased work commitments, interestingly, even non-BIPOC kids, we might think. These kids in LAUSD that were surveyed were actually supporting their families financially. And that is a very known stressor and precursor to mental illness and to suicide. And as the kids get older, it continues. We've known there's been worsening mental health on college campuses in the last years. 4 and 5 college-bound juniors and seniors in some surveys have said that their own or their friends' mental health is a very large source of stress. They really cannot function and they know it and they want help. And when they get to these college campuses, and we'll hear more perhaps about earlier in their education today from the panel, but when they get to college campuses, they're not actually more able to access care. They recognize they're less able to access care today, even though universities and college leadership are really focusing on this issue. So it's a good thing that we're focusing, but unfortunately, it's not enough yet. And you'll probably hear similar from our colleagues on the panel. And this is how it unfolds. Didi Hirsch, we pioneered the nation's original suicide hotline. There are now multiple crisis lines that come through. Glad to have our friend Joel from LAUSD here and others, where we have hotlines that we support. And what you see here is that there's actually a disproportionate interest in modern technology. This is why it's so critical for younger generation as we think about our roles at the system level to focus on digitalizing care. They want chat and text. They don't want to call, as we think about the 800 hotlines of yesteryear. And there's changes also, there's disproportionality in who contacts us based on how they identify. Increased interest in BIPOC populations for text compared to chat, but maybe more interest in phone, interestingly. Females being more interested in texting, those transgender questioning significantly preferring texting, and even worsened validated suicide risk among young people who are using chat and text. So they already arrive needing great care, and it takes us a lot of time, but I'm grateful to show that we're able to reduce in that first encounter with great skill their needs. And so the need is great, as we identified. And I think the hope that I have really rests on so many making historic investments and calls to action for mental health. This from the President of the United States for the first time in a very long time, calling for mental health equity and parity. This from our United States Surgeon General, which you're probably all familiar with. If you're not, this is kind of an all of society approach, from parents to teachers to school counselors to universities to tech companies to employers. The Surgeon General implores all of us to do something and give some great examples. And this is what it looks like in the field. This is what we offer at Didi Hirsch, one of our service lines where we're able to provide wraparound crisis care 24/7, including with partnerships like Teen Line, for teens by teens that are there for their peers in a crisis, highly skilled, highly trained, services for staff, services for teachers. We also recognize the fragmentation in our mental health system. We have to manage that and support folks getting what they need in between the crisis intervals, and we provide consultation and education. More specifically, for those who work with young people or for parents who might be watching tonight, the trauma is essentially agitation in the body and the brain, right? And that's what it's causing. And so it's not surprising that the efforts that we can think about to help kids practice have to do with really getting their brains, their minds to calm, to focus, to not allow the agitation of stress or that feeling of insecurity, I'm not safe, to take control. And so deep breathing, mindfulness, meditation, journaling, artistic expression, things that you have to really engage in some intensive way, but take you away from the stress and keep your brain calm, focused, creative. Grounding techniques, being present, right? Positive self-talk, encouraging kids to actually, I'm great, I'm good, everything is good, right? I'm the best this, I'm the best that. It really makes a difference, and we should be talking to our kids that way as well. Challenging the negative thought. They have to be comfortable and have a trusted adult peer to share that they're struggling with their mental health, to share that they're having a thought of something not being too healthy or too good, and they don't feel good about it, but saying, okay, well, let's talk about it without judgment. And of course, we all kind of know good sleep, exercise, good nutrition as well. These things actually have been shown to decrease the toxicity of stress in our blood and in our DNA. So these are truly healing practices. Kids also have great expectations today. I say to my wife, I can't believe how many things our kids are involved in, right? Today, I would not have survived that as a kid, let alone in a pandemic. So we're scheduling them to do so many things, but that includes on top of it what they have to do for school. So we have to really try to help kids prioritize, not to take on too much per se in their schoolwork. A lot of schools have tried to decrease what are expected of kids, obviously, while hopefully keeping their learning as optimal as it can be, and setting realistic goals for where they should be at any given point in time. For parents, it's really important as your child's first teacher and your child's really go-to safe, stable, nurturing relationship to be mindful of what's going on with them, to be monitoring for things like symptoms of anxiety and depression, which look different at every age, but generally you're looking for developmental regressions, resistance, refusing to do something they might have done, disinterest in things, or not really having the energy, kind of showing more upset, going to birthday parties or family, increased crying, obviously, but also defiance, irritability, changes to behavior like sleep and eating, worsening grades, and including worsening physical health if they have asthma, overweight, other medical conditions that trauma can exacerbate. And our response really needs to be compassionate, non-judgmental, curious, asking questions. Tell me more about how you feel. I noticed that. And leaving it at that, trying to give the kids the space, the grace and the space to feel comfortable and share how they feel. That safety and security we give back in our interval interactions are critical and healing of the toxicity of stress. And then, of course, we want to teach them some of the activities I mentioned. There are different things to think about for anxiety versus depression, a very high level anxiety about coping. What's their go-to? With depression, more about positive reinforcement of good steps forward, healthy steps forward in terms of finding what motivates them. Be an advocate. We do all as parents, as teachers, as others have to go and ask for kids to get the help they need from our schools, from mental health care. We know there's not enough mental health professionals out there, so we have to keep pushing because it's that kind of expertise that's ultimately going to treat and heal a lot of kids as well. And then we have to manage our own effects of the trauma, including substance use, which studies have showed is greatly on the rise, including in parents of young children. It's a little bit scary if you think about it. A lot of kids stuck at home with parents suffering from anxiety, depression as well. So if we don't treat ourselves, put our own oxygen mask on, right, first, how can we take care of our children? For educators, and I won't belabor this for those that are on here, they know, right? It's about detecting those patterns as well and being that baseline emotional support that the children's need, which will directly affect their academic achievement in addition to their overall health. So, all those quality measures that we have about behavior are also quality measures about achievement. And this is really about that as well. We want to also partner with local experts, not feel that we have to take it all on ourselves, to really focus on where we as experts can come, support your efforts, however we can help, as I know we do, Didi Hirsch, with so many hundred schools across LA and Orange County. And we can provide education. We can focus on trauma-informed approaches. We can give just-in-time training. Sometimes you have their annual requirements, and it's not necessarily what you need in the moment if you're a teacher or a counselor and you're concerned. A lot of our firms or providers in LA can provide consultation, and certainly Didi Hirsch and a few others are experts in suicide prevention should there be any thoughts kids raise or even attempts. And then engage youth in your solutions. They really want solutions for them by them. So peer services are critical. There are so many resources out there. This is not Didi Hirsch. This is Child Mind Institute in partnership with the state of California, Jen Siebel-Newsom and the governor and others. Take a look. They have a California Healthy Minds Thriving Kids project. Great videos, really straightforward for parents, for educators, and for kids. Anytime you can dial 988. This is a PSA we did. A lot more is coming. Come July, we're going to ask all schools and educators to be mindful of how they integrate 988 as an opportunity to support kids, teachers, counselors, and other staff in crisis. And then more specialized, if there are people in your midst, whether the children, the teens, the family members, the adults, the professionals of any kind, with thoughts of suicide or who've suffered an attempt or a loss, tragically, we are there. We can heal you. Just have to visit us at crisiscare.org, and we offer individual, family, and support groups that are suicide specialized. You can contact us anytime at crisiscare@didihirsch.org or crisiscare.org. These are the different levels of supports and resources we can offer. Thank you.
Well, thank you so much, Dr. Goldfinger. And thank you, all the work that goes behind all these services that you provide to everyone and all the folks on your staff. A real service to our community and to our young people.
Thank you.
Let me now go to our panelists. So that was a great kind of overview of some of the services that are available and also some of the challenges. We've got three panelists. So Shuli Lotan, who's the mental health counseling coordinator for Santa Monica-Malibu Unified School District. We've got Joel Cisneros, who's the student mental health director for Los Angeles Unified School District. And then Kati Krumpe, who's the chief academic officer for Torrance Unified. So let's start with you, Shuli. Can you tell us a little more about what Santa Monica-Malibu Unified is doing to support students?
Absolutely. Thanks. First of all, just thank you so much for having me a part of this panel. It's quite an honor to be here with you all. Just have a few short slides. I wanted to talk a little bit about some of the trends that we're seeing across our school district, some of the strategies we're using to intervene and provide supports, and then, of course, resources. So as the counseling coordinator for our district, my role is really to manage all of the different agency partnerships that we have and to supervise interns myself who can provide some of the direct service. So it's been quite a ride the last few years, as all of you are aware. Prior to the pandemic, we were seeing really high rates of anxiety and depression in our students. even more so as compared to other local areas. But because of the pandemic, we've really seen a spike as well, especially in the areas of depression. I think we're seeing that show up not only as suicidality, but also just a kind of general lack of motivation. A lot of students are talking about how hard it is to feel engaged and motivated for schoolwork. We're seeing an increase in separation anxiety and school refusal, and also a really big one just around the social environment. Reintegrating back into school after schools were closed was not so hard for some, but pretty challenging for a lot of our kiddos. Just going back into that social environment brings up a lot of social related anxiety. As I think Dr. Goldfinger spoke about before, we are seeing just a lot of nervous system dysregulation in our kids as well as in our adults in our systems. And there is more verbal and physical conflict we're seeing on our school campuses, avoidance of school or responsibilities. So that can kind of, relate to that fight or flight response when you feel like you've been through a trauma, right? That's often the initial body reaction is to fight or to get out of there. So definitely seeing trauma responses in a lot of students. We've seen since the pandemic a pretty significant increase in eating disorders. And some of this is showing up, within individuals, but there's also a lot of social media stuff coming around, with body shaming and making fun of other people's bodies. There are just many issues that just are pretty entrenched in families where parents have their own mental health needs, which of course is going to affect the kids that live in the home with them. And then a lot of stuff around self-esteem. We really are seeing the social media influence as not being super positive. It's really affecting relationships in school. We're seeing more cyberbullying happening as well. I think because of the pandemic, a lot of us parents can relate, right? When we were all home, kids just had more access to technology. They had to use technology to do school. And so that also led to maybe an increase in kids' access to social media earlier on. So there's a lot of reasons why I think, we're seeing some of these issues increasing. We're seeing a lot of families are requesting referrals to higher levels of care, like intensive outpatient programs, where, typically our students would maybe get a once a week outpatient therapy session. It seems like that for some kids is just not enough. So we're doing a lot more referrals to specialized programs. There's a lot of students who are coming into schools with different diagnoses that are, enabling to have like 504 plans or IEP assessments where the mental health issues are really affecting their ability to access their curriculum. And we're doing a lot of risk assessments on suicidality. For the most part, those are pretty low risk where it's, some thoughts, but not a lot of intent or plan, and that can be managed internally. But we are, like we were before the pandemic, having to rely on our higher level systems as well, like PMRT. In terms of strategies, we can go to the next slide. Thank you. We are seeing, fortunately, some money coming in from COVID relief funding to school districts. And we're able to really use that in a nice tiered model where we're doing as much as we can in terms of prevention, right? Embedding supports within the classroom. So these are things that all students will get. A lot of our teachers have been trained in mindful schools. So they're doing those kind of morning meetings and bringing mindfulness into the classroom. We have been able to create a position in our district for a teacher on special assignment, or a TOSA, that's specifically for social emotional learning. And she's been doing a great job of training teachers across the board on how to integrate more social emotional supports. And then things like flex time, for example, at Santa Monica High School, which is just a time where students can access teachers to get extra support, or perhaps a mental health related workshop or presentation. So that's kind of our tier 1 strategy. Tier 2, we are trying to offer more counseling groups on our school sites for more specific issues like eating disorders or art therapy, LGBTQ plus supports, a lot of different groups that we're really trying to get off the ground. There's been a big need for social skills groups for younger kids. We're seeing a lot of our, first graders and second graders who were really, not getting that social interaction for the past few years. who are now needing a lot of support and just how to be a good friend. We are doing presentations and trainings for parents and teachers, parenting support using things like reflective parenting models, our parent project, which is a partnership with St. Joseph Center and our police department, and just trying to create as much parent support group as possible. And then really knowing that our teachers and staff are going through it as well, trying to do as much as we can with wellness initiatives for staff. It has been a little bit challenging to implement because I think teachers are just so strapped for time and just trying to do as much as they can. There's a big lack of substitute teachers. So it's hard for teachers to take maybe the self-care time that they need and take a day off. But we are putting together a lot of information for staff that needs to, that they can use to, take care of their own selves. And then of course, trying to just increase as many positions as we can just to get those kids into tier 3 individual therapy. So in terms of resources that we have on the next slide, we are, there you go, partnering with a lot of community mental health agencies. We have partnerships with the Boys and Girls Club of Malibu, Edelman, Family Service of Santa Monica, Claire Matrix, Providence St. John's, Social Emotional Wellness Initiative, Insight, Our House. We have a community schools program at Samo High through Laco. So we're very fortunate to have a lot of great resources in our district and these partnerships, and we can really leverage funding in a nice way. We have our district MSW program. We have, of course, our school psychologists and our school counselors who are kind of frontline folks. And we have a very effective referral process for school-based mental health services, which all this information you can find on our district website under health services. And then, of course, when we do hit capacity, which we always do every year, we refer families out. But it is really challenging right now for folks to get connected to therapy, even when they have really good insurance. But we do have a lot of ways to get people connected out there. I did want to just mention Teen Talk and Teen Line as a really great support for kids who are not only using those services as like the ones calling in or texting in, but Teen Talk also trains kids to be the providers of those, the answerers of those calls on the other end. So we're really fortunate to have a partnership with them as well. I know we are a little short on time, so I'll wrap it up. My contact information is here on the next slide. So for anybody that has students in SMMUSD, feel free to reach out to me directly if you need any help getting connected to these great resources.
Thanks so much, Shuli. I know you've been working with UCLA Champ Clinic to provide free therapy sessions to students. We actually have Champ Clinic's clinical instructor and psychologist, Dr. Mark Weintraub here, and I just wanted to give him the chance to give a brief moment to share a little bit more about that program before we move on, because I think it might be of interest to folks.
Great, thank you for having me. So, like Senator Allen mentioned, I'm a psychologist and clinical instructor on the faculty at UCLA in the medical school, and specifically working in child and adolescent mood disorders program, which is a specialty service. And we've worked our team with Shuli at SAMO to kind of help bridge the gap between schools and treatment services. And at CHAMP, we provide assessment and treatment for youth with mood difficulties, including depression and bipolar disorder, and have a variety of different clinical and clinical research offerings, one of which is a cognitive behavioral therapy group for high school aged youth with mood difficulties. And this group is a skills-based treatment that helps teens identify unhelpful thoughts and behaviors and learn strategies to engage in more helpful thoughts and behaviors. And we also have family therapy for youth who are struggling with mood or are having unusual thoughts or perceptual experiences that may place them at high risk for developing a psychotic disorder. And our family therapy work helps teach about mental health symptoms and provide communication training and problem solving. And one really exciting new avenue. This is kind of piggybacking off of Dr. Goldfinger's point in terms of meeting teens and youth generally. Where they're at is our group is developing mobile apps to incorporate our treatment skills. The apps allow teens and parents to review treatment sessions, to practice skills, log how they're doing, and that's a big part of the work that we're doing in research to learn more about how these apps can be useful and how we can optimize them. So, surprisingly, to some, spring's a particularly stressful time for mental health, and like others have mentioned, the effects of COVID still linger, but we're hopeful and would like to be able to offer services to any who might be interested. I don't have any slides prepared, but can enter some information into the chat for everybody to be able to see more information about the CHAMP program. Look us up online, contact us if you have any questions in terms of how we might be able to provide services.
Great. All right. Well, thank you. Thank you, Dr. Weintraub. I appreciate that. All right. So now let's have a chance to move on to Joel Cisneros from LAUSD, who's going to tell us a little about some of the programs in the district there.
Yes, thank you, Senator Allen, for the opportunity to share this and hosting this conversation. Obviously, very important to focus on the mental health and wellness of our school communities. I think something that's really important, I know we're short on time, so I'm going to talk through my slides, is that we really want to make sure that even though the initial impact of the COVID-19 crisis is behind us, that there really, if we start thinking about crisis theory and recovery, that the rebuilding process of this crisis, and especially of this large-scale event, is going to take a long time. And so we really need to start thinking about that as well, right? Because we've been talking about 2 years in a crisis, period. And so the opportunity for us now is to really invest in appropriate infrastructures that will allow us to kind of mitigate this crisis, but also be able to establish key partnerships, but build the capacity within our systems. And when I mean systems, I mean family systems, school systems, every sort of system to be able to be responsible to promote resiliency practices in order to really provide that post-crisis growth that we all seek. And so in LAUSD, we've been able to, just hone into the theories and the practices of resilience to really be able to mitigate and stabilize this crisis. But most importantly, to think about a way to move towards developing a healthier system. So for us, really, the focus has been, how do we increase access to mental health or any sort of resources that our community is experiencing? And while we know that we have received, as I think Shuli mentioned earlier, school districts received a lot of funds, federal funds, to really help build the infrastructures around mental health, we still have a need for mental health staff. So what that means, we need to ensure that people in the community have access to call and find out what they need, find out what they're needing, and connecting them to that resource. So for us, in April of 2020, we launched a community hotline resource line for LAUSD families. That phone number is 213-241-3840. And we've received over 35,000 calls since then. And mainly those calls are really around families wanting mental health services and other basic needs. So what we've been able to do is 50%.
What's that number one more time?
213-241-3840. And 50% of the 38,000 calls have been parents and caregivers asking, like, how do you get me to a resource around mental health? So we know that was our first priority, give access. Secondly, really is around building resiliency-based curricula in the classroom, really making sure that we're able to provide those foundational opportunities for students to be able to rebuild. So we have a wonderful partnership with Headspace. I know many of you may be familiar with that. Inner Explorer, all of sort of different types of practices that can be incorporated in part of the instructional day. In addition to that, we've partnered closely with UCLA and developed curriculum aimed at building resiliency building skills. So that's some of the strategies we've incorporated as well. Also wanting to make sure that I'll drop it in the chat in a moment, but we were able to, at the beginning of the school year, develop a parent and caregiver roadmap for social emotional wellness, where it, again, relying on the science of resiliency and how to build those resiliency factors so that parents and caregivers are able to hold those conversations, be able to be, engage in that psychological first aid that we all can engage in. And then lastly, the most important thing, and I just had a conversation earlier this week with Dr. Goldfinger about the importance of engaging our youth. Our youth and our parents are co-contributors in creating solutions. So for us in LAUSD, really wanting to make sure that we engage our youth as, again, co-creators of these solutions. So one of the things we're doing actively is developing youth's ability to not only be mental health advocates, but also be able to be educators, be able to provide those resources to their fellow teens so that they can get those resources that are needed. And I'll plug, the hotline as well, 1-800-273-8255. We know that number is so important to making sure that we help people in crisis. So I know we still have time. I want to reserve my time for the Q&A portion, but thank you.
Great, thank you. Thank you so much, Will. I appreciate it. All right, so we're crisscrossing around Los Angeles. We're now going down to the South Bay to hear from Dr. Kati Krumpe from Torrance Unified School District.
Yeah, thank you. And I think I'll just try to synthesize so to not be repetitive from all of the experts in the room to the layperson now, right? I'm in charge of academics, and although the mental health services is certainly underneath me, I'm by no means a mental health expert, and so I can't begin to I appreciate everything I've heard, and it warms my heart to hear both the passion and the knowledge that are in this room about such an important topic. And thank you, Senator Allen, to hear the legislative support, and then some hope on the credentialing side for some of the, so fingers crossed. So I want to take just a little kind of different thread here to kind of synthesize this and really talk about the role that our families and our students have played in this whole process. We really took an approach in Torrance, and I think through a lot of our friends throughout the South Bay, in trying very hard, pre-return to school. Our distance learning platform had a daily, screening check-in. And thankfully, with this phenomenal counseling team that then took that on the back end and made those immediate contacts with those kids. And you've all spoken about the resources that we were given. Our students, when we started talking about returning to school and put a student kind of leadership team together, they just strongly advocated for the resources that they need in mental health. And we've spent more than a third of the monies that we receive, both from state COVID relief and federal monies, on mental health services. And so literally doubling the amount of our mental health department for the return to school. And yet everything that we've heard here, and it's still a challenge, both finding those professionals. As soon as we add more staff, those slots have filled. But we've designed with our community a Building Bridges collaborative, and it's a really strong group of school district and community supports that allow a common referral process so that we can ensure that they get the right help, but also the help that they're entitled to, and it kind of helps us spread the wealth, if you may. If somebody, it may qualify for services that others don't, it allows us to just take those thin resources and spread them as far as possible. Our students told us, please help. The top trends that we're seeing, I think, really mirror what was shared, especially the depression and anxiety. Anxiety is absolutely our number one need. And our students asked us for something that we were thrilled we were able to deliver, and that was that they wanted wellness centers in all their schools. They wanted a place that they could pull themselves out when they knew that they needed the help, and have a calm place that there might be an expert on hand if needed, but if not, until they could get there, there was just a safe place to go on campus. And I think I'm just thrilled that these ideas came from our students and our families, and that the adults on campus were I think for our families listening, we want to hear from you, and when your students speak, we listen, and we want to hear even more from you, so that we can better respond. We're looking similarly to what we heard about the training of our. So I took some notes, but we're now hearing, and thankfully we are seeing some improvement. So I want to share some hope. Some of the initial behaviors, especially with our littles, the aggressive nature of some of our behaviors that we saw at the beginning of the year. We are seeing that a large number of our kids are improving, and they are self-advocating, and so we're hopeful that we can continue and sustain some of these supports. But most importantly, I think that if something good can come from this pandemic, is that we've risen to have these conversations and make mental health more on the forefront of the conversation, and people and our families are feeling more advocacy and comfortable advocating for what they need, so we can hear from them and then deliver what they want us to deliver. Thank you.
Thank you so much, Dr. Krumpe. Wow, and thank you for all the panelists for giving us this broad overview of the resources and support that are already available to students and families, and thank you for all the work that went behind all these presentations. I mean, there's so many people that you all have working out in the schools every single day to give support to students. We did give an open a call for questions from folks who are going to be participating and listening in today, and I've been going through the questions and trying to figure out some that have not been answered yet. One of them has to do with long COVID. Do you have any? Can any of you speak to how schools are supporting students suffering from long COVID, specifically mental symptoms like brain fog, mood changes? Have you seen this? Has this come up? I mean, one of the follow-up questions on that was whether parents of impacted students should actually consider filing for a temporary 504, given that the unique circumstances around long COVID. I see you nodding, Dr. Krumpe. Has this been an issue that's come up in Torrance?
It hasn't, to the extent that I think people are still not sure what long COVID is and what long COVID might be in children. But so regardless of whether it's diagnosed yet, and we are fortunate that we've had some low transmission rates, and we've heard some positivity around the neuroplasticity in children, that maybe it's going to any of the fog or long lasting or current symptoms might go away sooner in our youngers. Still, again, fingers crossed. 504 or not, whether it's a formal piece that with a doctor's note prescribing or not, if our children are exhibiting symptoms and need help, we're going to provide them with that help. So that's just reiterating, we have a number of issues surrounding kids recovering that we want to put in place, starting slow, different pathways for them, what kind of supports that they need. And I bring up the wellness center again, not to be repetitive, but they're using it for that. They need breaks. But just reiterating that your teachers are your teammates, And whatever those things are, I don't know if we know yet what it are the right things to help. And so when you not advocating to not formalize it around a 504, but your teachers are gonna, like, let's work together on this, because they're ever changing symptoms. This isn't something we know a lot about yet. And so we want to be partners with the parents so that we can figure these things out. I often tell families, let's figure out what it is that works, what modifications that you do think that you need. And let's work on that, before there's a formalized piece that we put in place, because it might change.
Yeah. All right. If anyone wants to add to that, you can add thoughts as we go through the rest of the questions. But I thought that was great, Dr. Krumpe. I appreciate that. Let me build on your last comment about teachers being part of the team, because there was a question we got from a constituent who said, "Do teachers receive?" We've been talking about counselors, and of course, we're all working on trying to get more funding for counselors and deal with the shortage there. But what sort of training are the teachers getting with regards to identifying students who may be suffering from a mental health condition? I know they're starting to do more of that in teacher training in general, but is it adequate? Are some of the teachers who took their teacher training a long time ago getting enough? Do they have enough background in this? What can teachers do to help students who need care? Who wants to take that?
Yeah, I can take that from the LUSD side, meaning that, I think you raised two really important things there, Senator Allen, is that one, definitely, I would love to see more legislation looking at CTC and the standards and how we incorporate trauma and resiliency based kind of strategies, so that then, like you said, more schools of education incorporate this into their credentialing process. But then that's long term.
So even now, it's not happening enough, is what you're saying. So I know it wasn't happening enough back in the day, for sure.
I would say so, but then again, I'm the mental health person in the room, and Dr. Krumpe can speak as the academic person, right? But I want to believe that there should be more. But that's long term. But like short term, like what do we have right now? So what I actually dropped in the chat was actually a link to our roadmap, not only for parents and caregivers, but also for educators, because we know that educators are in the front line. We can't do this without those teachers, right? And so we want to build their capacities as well around like what can they do to really foster resilience and be able to kind of establish those safe and welcoming environments. In addition to that, a lot of what we've been doing in LUSD is really trying to approach this in a tiered approach, really meaning like, what are we doing for all, and then what are we doing for some? And so for some, what we're doing is we do have crisis teams within each school district, and so within each school, I should say, and really wanting to make sure that teachers know that at what point do they need to refer to their crisis team, so that that crisis team member can take over. But we are offering district-wide. Each year, we offer a suicide prevention and awareness training that we're constantly trying to make sure that, as part of an assembly bill from a few years ago, wanting to make sure that that's incorporated. In addition to that, we do offer a variety of different PDs for our staff, but definitely I think it's an opportunity here, as this mental health and wellness is in everyone's kind of ecosystem. Like, how do we kind of just embrace it even more?
Yeah. Okay. Anyone else want to add to that, or any interesting stories? Or I see Shuli.
I mean, similarly in our district, we absolutely train all of our school staff, elementary through secondary, on recognizing those signs and symptoms of depression, suicidality, how to refer. We've gotten some great partnerships through UCLA and our Community Schools Initiative on trauma trainings for teachers. We offer like conferences for teachers on SEL topics, which is more of an optional thing. But, I feel like we are doing a pretty good job of making sure that teachers really have those. We're not asking them to do assessments of risk or intervene in any kind of mental health way, but to just be able to recognize and know who to go to when you have a student.
Exactly.
There's a red flag, like this is what you do. And I think we have that pretty well down. I would love, of course, to see more opportunities for professional development and all this, but of course, teachers' time is really hard to get.
Yeah, I know. Well, okay, so this next question, and a number of you have touched upon this. but this has to do with what parents can do to best support students who are struggling with the social anxiety associated with returning to the classroom after a year of remote learning. Obviously, a lot of kids have been back in the classroom for a little while, but I think a lot of parents are, and what we've seen with some of the questions I've gotten, just parents is feeling just so overwhelmed and also under resourced in terms of knowing how to, it's hard enough to be a parent. I know this myself, but under normal circumstances, but then to help your kid deal with this transition back to school after all the madness of the pandemic, and then also the continuing uncertainty. What any particular tips about how parents can best support students struggling with social anxiety? Maybe I can go to the two doctors. Well, actually, we have three doctors, but maybe Dr. Goldfinger or Dr. Weintraub.
Sure, I can start off. I think, the first thing for me as a pediatrician, not a mental health professional, but we really talk to parents about thinking about their own role in it, right? How are we feeling about our children going back to school? Are we anxious about it? What have we been telling them about, in-person interactions in the last few years? What's been our contribution? Are we feeling calm? Children's mental health is often a reflection of our own. And so we have to first and foremost think about ourselves and are we still contributing in how we talk about returning to school? Secondly, I would say, and I've seen this where some of the behaviors that we've heard about, even going back to school is not typical for kids, even thankfully with the masks off. It's not the usual for them when the other kids are potentially behaving in a way that wasn't what they experienced before. And so there's one aspect of general social anxiety, and then there's the individual kids are having trouble with their relationships with their peers. So this isn't just a general social anxiety. This is now individual nuanced instances with their interactions, increased bullying, etc.
Oh yeah.
So we have to be really mindful of, as parents and professionals, what's the individual kid experiencing that's contributing to this.
Yeah.
I can add just a touch more. I think that, that's really helpful, Dr. Goldfinger, and also thinking too about just maybe some practical steps that parents can take. I think first, it's really helpful to recognize and sympathize with the youth's difficulty in facing that anxiety and the feeling of it really being quite distressing. And then at the same time, thinking how we can systematically try to face that fear and what we could do to, one, prevent total avoidance, but two, how we can kind of approach some of those difficult areas. Because ultimately, school avoidance, social avoidance is not going to be a long-term strategy that's going to be successful. And so how we can think about, and this is a big part of the treatments that we provide, as we see Dr. Goldfinger's young one in the background approaching, this is a perfect example though, to even if it's tough and a little anxiety provoking or a lot anxiety provoking, we need to think about how we can
have mental health professionals to help.
in a slow and stepwise way start to approach.
Yeah. Well, look, we're getting down to the witching hour, and we'd scheduled this for an hour, but I just want to first of all thank you all for your participation. Thank you for all the folks from the general public who wrote in with questions. I think that there was a bunch of questions on a lot of different topics, obviously, but at least most of the questions that were very specific to this mental health topic were answered by one or several of you through the course of your presentation. So thank you so much for those wonderfully comprehensive presentations. And then I just also want to say, we're going to post the information from my office in the chat. If there's anything we can do in our legislative office, our district office, in Los Angeles, Redondo Beach, to just help connect people with resources, to connect people to the panelists, or if you also have input on legislation or other issues that you want to raise with us. We've been kind of helping people through lots of these kinds of challenges through the course of the last couple of years, especially the adults who are dealing with, with challenges getting their small business loans or eviction relief or other issues along those lines. Also, if you have ideas for future town halls. We've had town halls on a wide range of topics. If you have ideas, please don't hesitate to contact us. And we're always looking for interesting ways to provide more information to the general public about the such services, just like the ones we've discussed today, that are available to families and folks around the community. So thank you, everybody. I really appreciate your participation, appreciate your time, appreciate all the hard work and the sensitivity and compassion you bring to your work to do right by our families in our region. So really appreciate everyone. Hope you all have a very good evening and looking forward to being in touch.